Welcome to Pharmacology Lectures. Now we are continuing adrenergic receptors, also called as adrenoceptors. Now two main families of receptors are there, alpha and beta. Alpha and beta are also further divided, alpha 1, alpha 2, beta 1, beta 2 and beta 3. Now first we are going to study about alpha receptors. They respond to synthetic agonist isoproterenol. They are responsive to the naturally occurring catecholamines, epinephrine and norepinephrine. Okay, the potency is epinephrine is more potent towards the receptor than norepinephrine, and isoproterenol is less. Now you can see here, this is defined as affinity for alpha receptors. Okay, two type of adrenoceptors we have studied, alpha and beta. Alpha adrenoceptors, the affinity towards the alpha receptor lower to high, the highest epinephrine, then norepinephrine, and the lowest is isoproterenol. For beta adrenoceptors, the affinity for beta receptor highest isoproterenol, then epinephrine, and the least is norepinephrine. For isoproterenol, it is opposite for both receptors. Now we will see here alpha 1 receptor, the subtype. These are postsynaptic. Okay, they will mediate classic effects such as constriction of smooth muscle. Now activation of alpha 1 will initiate G protein activation of phospholipase C, which will result in second messenger inositol 1,4,5 triphosphate, IP3, just remember IP3, and DAG. Okay, IP3 will initiate the release of calcium from endoplasmic reticulum into the cytosol, and DAG turns into the other proteins within the cell. Now you can see in this diagram, it's better clear explanation. Alpha 2 receptors, this is norepinephrine in synaptic vesicles and exocytosis. Norepinephrine is released, it attaches to the receptor. This is alpha 1. Okay, this is alpha 2. Alpha 2, activation of the receptor decreases the production of CAMP, leading to an inhibition of further release of norepinephrine. It inhibits this process, production of CAMP, and therefore further release of norepinephrine is decreased. Next, alpha 1 receptor. Alpha 1 receptor, activation of the receptor will increase the production of DAG and IP3, as we have studied earlier, DAG and IP3, and these will increase the intercellular calcium ions. Now you can see here alpha 2 receptors, they are located on sympathetic presynaptic nerve endings, as we have studied up in the above diagram. When it is stimulated, it gives an inhibition feedback mechanism for inhibition to further stop the release of norepinephrine, and then alpha 2 receptors found on presynaptic parasympathetic neurons. Norepinephrine released from presynaptic sympathetic neuron can diffuse to and interact with the receptors and inhibit acetylcholine release. Now there is another mechanism to modulate autonomic activity in the given area. In contrast to alpha 1 receptor, the effects of binding at alpha 2 are mediated by inhibition of internalized cyclase, and they fall in the levels of intracellular CAMP. There is also further subdivisions: alpha 1A, alpha 1B, alpha 1C, alpha 1D, alpha 2A, B and C. But it is not necessary to understand in deep. You can just have a look. For example, tamsulosin is selective alpha 1A, and it is used in benign prostatic hyperplasia. As it is such selective, so it gives very low side effects, and you have to remember this drug for the treatment of benign prostatic hyperplasia, BPH, commonly found in elderly men